Hi everyone, I'm Dr. Rahul Verma. I'm the Director of Pediatric Sciences at Sir H.N. Reliance Foundation Hospital in Mumbai. Today, we would just like to have some words on monsoon diseases in children. The monsoon has come down on Mumbai with great vigor. We already have a lot of flooding, and along with that, we also have a lot of children reporting in ill. The commonest diseases that we are worried about is obviously malaria, dengue, typhoid, not so commonly leptospirosis, and of course, Japanese encephalitis. In the background, the continuous downpour of common viral illnesses like flu, parainfluenza, and other respiratory diseases do continue. But these are the other diseases which further impact our children, whether they are at home or visiting school. So, the problem is that in all these diseases, especially malaria, dengue, and typhoid, almost 20 to 40% of those affected are children, that is below 18 years of age. And not only that, specifically the 5 years to 7 years, I think, bear the brunt of these illnesses, either because they're very active, they're going regularly to school, or they are meeting in the parks, etc. So these are the children who obviously are down with all these monsoon illnesses and require investigations and treatment at times, not regularly, but sometimes they also have to be admitted for the same because oral medications may not help, and in which case we need to probably supplement them with intravenous fluids, antibiotics, and other supportive treatment. We need to understand that amongst all these illnesses, typhoid and malaria with dengue seem to be a bit higher this year as compared to last year. And this is because the schools have opened up. Uh, Children have now started moving out. They visit the park in the evenings. There is water stagnation around the premises of their homes. All of this contribute to the increase. Population, of course, is the single most important thing. An overpopulated place will obviously breed and propagate these diseases. So we need to be careful about that. So, how do we try to avoid these illnesses, especially for our children, including adults? But I will talk obviously about children only. So, the single most important thing at personal care is you need to have a home which is free of water stagnation. I think that becomes very important, especially down in the balconies or the flower beds, where normally we do like to keep some greenery as a reminder that we once used to have gardens. What happens is during the rainy season, if the drainage slope of these balconies are not adequate, water then pools around over there. And then, obviously, if we do not clean it out or regularly remove the water by whatever method we have, then it becomes a breeding ground for mosquitoes. So there are more than three types of mosquito species who breed in these and then propagate malaria, who propagate dengue, and are responsible for Japanese encephalitis also. So one of the biggest things we need to do is try to remove the excess water which is lying stagnant by regular mopping, draining of these things. Our air conditioning, even in the winter and monsoon season, we do continue using air conditioning because Mumbai is a very humid and warm place. So the water dripping from the exhaust of the air conditioning also stagnates out in the so-called refuge areas of each flat. I think that also needs to be sorted out. So draining and keeping these areas dry, though a very difficult task, is quite important in preventing the propagation of these mosquitoes. Second thing is routine pest control. So using sprays or using vapors or burning mosquito coils, whatever be the way, I think we need to understand that maximum influx of mosquitoes in the house is between 5:30 and 8:30 p.m. So keeping the windows and doors closed during that time, and if mosquitoes are seen, to effectively spraying them and killing them is a solution. Do remember that all these chemicals may, in the long term, due to overuse and poor ventilation, may harm us. We are not yet clear about it, but I think these are chemicals, and we should be very clear that we use them sparingly, and when we're using it, the child should not be in the room. So usually in the evenings, we suggest shutting down the doors and windows, using the spray, shutting the door, keeping the children out for some time, and then maybe after an hour or two, opening, ventilating these rooms and allowing the child in probably helps in reducing the load of mosquitoes. Coming to typhoid specifically, which is spread by contaminated food and water, we need to make sure that the water is clean. So there are multiple ways of ensuring clean water, or what we call as potable water, for the child and for the adults. One is boiling water, keeping it covered and using it. That is the most elementary way. Second is, of course, we get the water filters and chemical filters which may be used at home, and these are now routinely available. You don't need to boil filtered water. I think you can use the filtered water directly as long as you're keeping it closed. So that's very important. It should not be exposed to the environment. Everyone needs to wash their hands, because that is a very big way you spread typhoid. So ensure that everyone washes their hands, including the maids and the servants in the house, especially before handling vegetables, fruits, cooking. All of these times, I think whether it's the house member or the maid, all of them need to uh, wash their hands with soap and water. Coming down to the food that we eat, obviously eating street food is a strong no-no, and I think that is one of the biggest source of transmission of typhoid. And of course, diarrhea because of non-typhoid organisms like enterococci. So all of these, enterocoli rather, all of these are easily spread via street food because of hygiene matters and open gutters. So we need to make sure that we discourage children from having street food. Uh, if at home you're using vegetables, fresh vegetables, then we need to make sure that we clean them properly with water and whatever additives we can use, to preferably peel these vegetables and most of the fruits, and then to cook them, obviously after washing one's hands. So these are the simple things by which we would be able to reduce the transmission of waterborne diseases. So mosquitoes, food, and overcrowding. Of course, overcrowding is something which we may not be able to directly and immediately control, but more populated the area, obviously the transmission is going to be much higher. So, looking at these simple things like ensuring clean drinking water, ensuring avoidance of stagnation of water around the house and in the neighborhood, ensuring that your child wears full sleeves clothes, can put on a mosquito insect repellent from below the neck. Preferably avoid the time between 5:30 and 8:30 p.m. For influx of mosquitoes into the house, and vaccination. So typhoid has a vaccine. All the hospitals have provision to administer the typhoid vaccine. Only one dose is required now with the current vaccination. So that will help in reducing the incidence of typhoid infection in the children. There are other vaccines. So, Japanese encephalitis vaccine is available, and it is highly recommended for use after 2 months of age in the endemic areas. South of India, the coastal areas usually are very rampant with Japanese encephalitis, and now in the select population, we would recommend the use of this vaccine. Dengue vaccine, I believe, is still in the process of being released for public use, but there are at least two or three live attenuated vaccines available. They are in early trials, and hopefully, in a year's time, we should be able to see the use of dengue vaccine in children 9 years and above. Um, as far as leptospira goes, which is the last disease caused by being exposed to flooded water, I think the biggest thing is to request the children not to play around in stagnant and flooded water, which Mumbai is quite famous for actually. Washing our hands and feet after coming from outside, and appropriate investigation and treatment if we suspect the same. So here's a whole capsule encompassing monsoon diseases, which are common in Mumbai, how we could prevent them, and how we should look out for these diseases in the presence of fever, cough, tummy ache, diarrhea, vomiting. And effective treatment at the right time should help a child in recovering very fast. Happy to take any questions later on. Thank you very much.